Neuroendocrine from Neuroendocrine Cancer Australia, and I'm coming to you because it is Friday, the 22nd of January 2021, and welcome to our normal Facebook Friday live broadcast, and to everybody who's joining me live in our Facebook private discussion group, but also welcome to those who are watching later on down the track via our YouTube channel. So as you know, each week I broadcast in to provide I guess a bit of an unpack or a focus on a particular topic that's relevant to people with NETs. So before I go any further, I'd just like to acknowledge the traditional owners of the land that I'm broadcasting to you from, which is the land of the Wurundjeri people of the Kulin Nation, and just would like to pay my respects to elders past, present and emerging. One of the things I love about living where I live is running along the Yarra River, which is called the Birrarung in the Woiwurrung language. So I'm deeply appreciative of where I'm joining you from, and knowing that people are watching me from watching this video from all of the various corners of this vast land, and just wanting to, I guess, extend that acknowledgement and that respect to the traditional owners of the land that you are joining me from. I've got a big topic today to talk about, which is complementary therapies. So I'm really looking forward to unpacking some of that with you. But before I go any further with this, I just wanted to give you a brief update about COVID, which I frequently do on Fridays. The government has this week made some announcements about the way that the vaccines are likely to be unrolled in Australia. So we don't have information about exactly when the phases of those rollouts are going to occur. We know that it'll be potentially mid-February when we start, but we don't know how long each phase will be. At the moment, as I said, we're still waiting for more information, but on the information that we've got now, it looks like people with cancer may be in what they're calling phase 1B of the rollout, and so that's the first priority in terms of those vaccines will be the frontline health workers, aged care workers, those people who are extremely vulnerable, and then it looks like people with chronic illnesses and disabilities and those sort of still very urgent to be vaccinated groups should be stage 1B. Now, don't quote me on that because it could all change, but that's the best information I've got at the moment, and we're still trying really hard to get an expert to come in and talk with us on a Facebook Friday broadcast about specifically around COVID and NETs and the vaccine, and helping to answer lots of the questions that I know you all have. So it's a stay tuned. I'll let you know as soon as there's more to know, and we're all just awaiting to hear more about that. So the other thing I just wanted to say about COVID is that I heard over the last few days that there were some specific impacts for people in the Northern Beaches area in terms of accessing their cancer treatments. And it wasn't actually a situation with a person with NETs, it was someone who had a different sort of cancer. But I guess the invitation is always there to let me know if you are experiencing difficulties as a result of COVID related to your cancer treatment or your management, whether that's accessing treatments or whether that's being able to have visitors in the hospital, quarantine requirements, being able to access your tests and scans, extra financial costs. I really want to know about those things because we may well be able to work with our networks and advocate on your behalf to get things improved. So often we don't hear about, we can't change anything unless we know things are happening, and there's so many various impacts that this is resulting in across the country. So yeah, just feel free to let me know in an email is probably the best way to do that. And my email address is kate@neuroendocrine.org.au. So without further ado, I want to go delving into the very complex world of complementary therapies. And a couple of little disclaimers that I'll give from the very start. The first thing is that this is a really, really complex topic, and every person with NETs is different. In fact, every net is different when we look at it from a genetic level. So what I'm saying may not actually be appropriate for you, and please do always check anything that I say with your treatment team and your doctor. The other thing is, it's impossible in one talk to give a complete overview. So there may well be information that I don't have time to cover today. When I said, oh yeah, I'll talk about complementary therapies, I thought, that's doable in a Facebook Friday session. And I was planning this out. I was thinking, what was I thinking? Because it's really big. And, people go to university for years to study the individual branches of these treatments. So it's little wonder that it's going to be challenging for me to give you a complete overview. But hopefully by the end of watching the video today, you'll get more of a sense of what complementary therapies encompass, how they're different from alternative therapies, what we know that they can do, so looking at the evidence to support some therapies, and also how to keep yourself safe, so resources and ways of checking whether what you're thinking of doing is going to work well or be in your best interest. So Let's go on without further ado. So I wanted to talk about what complementary therapies are, because often these terms get bandied around and we don't actually really question what they mean. So these are therapies that don't necessarily have a high level of scientific evidence behind them, although we're growing level of knowledge on that. But for complementary therapies, the focus, rather than making cancers disappear, which is really the focus of the conventional therapies, the focus of complementary therapies are on the whole person and helping that person deal with the side effects of their treatment and the symptoms of their illness. And I actually had an email from someone from our private Facebook discussion group over the last couple of days when I mentioned that I was going to be talking about this topic, and she gave this example of after she'd had her last lot of PRRT or luteate therapy, she was just feeling physically depleted after that treatment. It left her feeling very, 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 very weak and washed out. And she actually went to a manual therapist who was doing, in her case, it was myofascial release. And, that's a physical therapy. It's like a form of massage, but for her, it's really revitalized her whole kind of her whole quality of life. So these are the things that complementary therapies can be fantastic in doing. So yes, they're designed to work with conventional therapy rather than instead of. So that's a really important thing to note as well. So there's lots of different types of complementary therapies. In fact, being part of the Facebook group that actually, we broadcast into, that's actually classified as a complementary therapy. So support groups is one of the things that we know actually has a lot of evidence to support. So it's not all just about taking herbs or vitamins or, going to meditation or whatever. Actually engaging in a support group can be considered a complementary therapy in and of itself. So there's mind-body therapies. There are body-based therapies. There are energy therapies like Reiki or therapeutic healing touch. There's the herbs and plants that we talked about, and also diet therapies. So there's a broad range of categories, and in amongst all of those categories are lots of different examples. So we're going to talk a bit more about some of those. But I just wanted to go back a step, because we talked about complementary therapies not necessarily always being highly evidence-based, and I wanted to talk about, well, how do we know? Like, what does evidence-based mean? Well, how do we know that something works? And there is, in the medical field, there is a really rigorous research project for any treatment that is recommended by health professionals. So it starts off in the lab, in the test tubes, and in the Petri dishes, and under the microscopes, and then in the design of clinical trials that then you know, if they've passed the laboratory phases, then they go on to various phases using people as participants in trials, and they are comparing new treatments or ways of managing symptoms with existing gold standard therapy. So, you know, one of the really important things to find out about a potential new treatment is, does it work better than what we've got already? Because it might work a little bit, but if it doesn't work better than what we're using, then there's not really any point in pursuing it too far down the track. The other thing that is really important in clinical trials and in the research that we do on treatments is getting a really in-depth knowledge of the side effects and the safety profile of these treatments. So there are actually, as I said, we're getting an emerging body of knowledge with a really quite significant number of complementary therapies with those things. So we're looking at side effects, with safety, with efficacy, which is whether it works or not. There is some variation there. So that's just something for you to know. So why would people use complementary therapy? Well, I mean, apart from anything else, we know that quite a lot of them actually do work and do help people. And so we want people to be engaging with things that will help them feel more well, help them feel better. We know that they can improve quality of life. We know that they can ease symptoms. We also know that they can help people deal with the side effects of the treatments that they're on. And these are really important things because, you know, it's all very well to make tumour cells grow or make tumours grow, make tumour cells shrink or to make tumours disappear. But if we leave you feeling awful and you're dragging yourself around and just feeling woeful, then, you know, you've got to wonder, are we actually doing you any good? Like, we want you to be able to live as full and healthy a life as possible. Some complementary therapies we know actually help strengthen the body physically so that you can cope better with upcoming treatments. And, you know, there is some evidence around boosting your immune system. We know when you're eating well, when you're well nourished, you're going to have a better functioning immune system, and that will, you know, boost the body's natural ability to not only cope with the side effects and, you know, ward off the toxicities from treatment, but also potentially strengthen your immune system to fight cancer cells, which is what we really want. So, but I think overall, most people with cancer these days want to be an active participant in their healthcare. So it's not just about going and seeing a doctor and then giving you a medicine and going on your merry way, although for some people that is the case. But most people, they want to know more about what they can do at home in their day-to-day life that is going to enhance their outcomes and their quality of life. So, you know, that's really the reason why I think a lot of people engage in complementary therapies. We want to do as much as we can to give ourselves the best shot of living well and living long. So, you know, that's not a silly thing to do, to be looking at. So, as I said before, some of the examples of complementary therapies, and I'm not going to go into these in great detail, but at the end I'm going to talk with you about some resources where there's lots of information about the various types of complementary therapies, because there's gazillions of the things. But, you know, support groups are definitely part of that. Exercise physiology is actually considered to be a complementary therapy, but we've got really significant evidence in several different sorts of cancers that exercise physiology actually, you know, changes cancer outcomes. So that's, you know, that's these things, they're not just about making you feel nice, they can actually really help you cope with your treatment and do better. Diet is considered to be a complementary therapy, and I just wanted to pause for a moment with diet. In neuroendocrine tumours, there are demonstrated nutritional deficiencies that can occur and side effects that are related to the treatments that are related to our nutrition and diet. And so even though it is classified as a complementary therapy, I would argue that for a lot of people with NETs, managing diet and having a full assessment of your nutrition would be considered as core to your management. So that's just a net specific proviso that I would give around diet. It's not just about healthy eating. It's actually about addressing deficits that we know are common in NETs and that will need to be looked at. So hypnotherapy is another complementary therapy, and that's actually strongly evidence-based in some specific situations. So a lot of people, probably traditionally would have put hypnotherapy down in the fish slapping kind of end of things in terms of complementary therapies, but actually there's been some clinical trials into hypnotherapy, and there's been significant findings in the areas of pain and anxiety and nausea and vomiting. So that's really interesting. Acupuncture is another complementary therapy that has had some significant clinical trials, and we now know there is an impact particularly in chemotherapy-induced nausea and vomiting. Having said that, if it's working in chemotherapy-induced nausea and vomiting, it's worthwhile considering in just nausea and vomiting that's not related to chemo, which I know a lot of people with NETs experience. But also sizable impact in terms of anxiety, in terms of fatigue. For people with hot flushes, and reading between the lines, I'm thinking that's people who have had androgen deprivation therapy or hormone therapy for breast cancer or for prostate cancer. We have hot flushes with NETs, and I'm not sure as to whether there's any evidence around acupuncture and NETs. There is a video. It's not a very good. It's got really terrible sound. So I'm sorry. There was a video that we recorded from our Melbourne support group a couple of years ago. It was before we had a decent camera, and it's taken on my wobbly phone. So the sound isn't very good. You'd need to turn the volume up. But I'll make sure I put a link in the notes to the video. We had Christine Lee, who is a traditional Chinese medicine practitioner and accredited acupuncturist, talk with our Melbourne support group about acupuncture. So yeah, you're welcome to watch that video. Acupuncture, anxiety, fatigue, hot flushing, but also with pain. There's some findings around managing pain with acupuncture, so that's really interesting. Also massage. There's a lot to be said for the use of massage. Traditionally, we used to worry about massage potentially increasing blood flow or lymph flow, and then potentially we were scared about that seeming to increase the risk of cancer spreading, but we don't have any evidence, and we've been using it for a really long time. We don't have any evidence that general relaxation massage has any increased risk of that. There are some safety precautions with massage in relation to people who are having chemotherapy, who are having radiotherapy, who have recently had surgery, or who have bone metastases. So that's just worth knowing about massage. But I guess that's the thing with any of these complementary therapies. There will be situations where it won't be recommended for you. And I guess that's one of the challenges with complementary therapies, is that because it's there's less evidence and it's less recognised, not always, but often, these therapies are not funded. So there's less in the way of Medicare rebates and even private health rebates. More and more, the major services are actually providing some of these services as part of their cancer treatment centres. So a really good example of that is at the OBrien Lifehouse, where they have an integrative cancer, medicine stream with their own medical specialist, who's Dr. Judith Lacey, who we heard from talking about medical cannabis, last year. So they have a variety of practitioners who provide complementary therapies to people who are undergoing cancer treatments. But also there are lots of different wellness-focused services at lots of different hospitals that provide cancer treatments. So it's actually worthwhile looking at your hospital and looking at what services are available. And I think I went down a little bit of a side alley that I was going to go through later on. That was the thing, because a lot of these services are not funded by the government. It's natural to want to try and get access to these things in as much of a cost-effective way as possible, and sometimes that means that people will do their own research, which is great, and it's really important to be well informed about anything that you're putting in your body. But there is an associated risk with that if you're not talking to a accredited, trained, qualified professional about what you're doing. There are some risks about that, so I'm going to talk about that a bit more down the track. Excuse the side alley conversation, we'll come back to that one. I wanted to give you some broad guidance around how to tell if a complementary therapy is okay. You know, how to make a decision about whether this is going to work for me, whether it's going to do me any harm. The first thing you really want to be thinking about, especially if you're consulting a practitioner, a complementary therapy practitioner like an acupuncturist or a naturopath or a massage therapist, is whether they're happy or really if they're keen to work with your doctor. We want them to be curious about what your existing treatments are, and we want them to be taking those treatments into consideration when they prescribe your therapy. So for example, if it's a massage therapist, look for someone who's going to ask you about whether you've had chemotherapy or radiotherapy. If they're not asking any of those questions, then you wonder how much they know about working with people with cancer, and I guess the risk is there that they may do you more harm than good. So they need to work in with your existing healthcare team and your existing therapy. Also watch out for if they have a professional qualification, and or if they are accredited through a recognised professional organisation. And I'm going to stop at this point and just give a plug to, and I do this all the time, these resources are brilliant. So this is from the Cancer Council. I'm just going to see if I can get it on my camera. It's called Understanding Complementary Therapies, and these booklets the Cancer Council will send them out free of charge to anyone in Australia. In the back of this booklet is a list of recognised professional organisations. So there's a double page spread of all of the various ones, which is really fantastic. So if you are seeing a massage therapist, you can have a look in the Cancer Council booklet and you can see there they've got the Association of Massage Therapists. If you want to see an acupuncturist, check whether they're in the Australian Acupuncture and Chinese Medicine Association. So this booklet has all of the websites and details for how to get more information about those professional organisations. But I guess it just increases the chances that you're seeing someone who has done some study, hasn't just taken it upon themselves to call themselves Dr. Smith, natural therapy practitioner, and might not actually have any proper letters up. They might have. We don't know where they got their qualifications from. Maybe it's the back of a Wheaties pack, but we hope it's more rigorous than that. So checking if they're part of a professional association is really important. So I'm just going to have a little look at the comments just to make sure I'm not missing anybody's questions. And someone has actually commented about the services that are available through their palliative care team. That's a really important point, and I'm really glad that you mentioned that, because the focus of palliative care, and that's a topic of a week to come, so we will certainly be taking a bit more of a deep dive into palliative care in the weeks to come. It's on my list of things to really look at. But one of the focuses the main focus of palliative care is around symptom management and comfort and quality of life and the whole person, in fact the whole family. And so often you'll find with palliative care services there might be a little bit more openness and access to fully funded complementary therapy services through that. So a lot of people worry about a referral to palliative care, but that can be one of the really fantastic things that can be available to you as part of those palliative care services. So this person mentioned they get free massage from the palliative care team every 3 weeks, and that's fantastic. And I guess knowing that practitioner is being supplied to you from a palliative care service also really gives you some confidence that they're going to know what they're doing. So that's fantastic. And someone else has just said, I'm using a physiotherapist and massage at the moment with the oncologist's blessing, and that's really takes in mind one of the really important things that I would say over and above everything else is please talk to your doctor, talk to your treatment team about anything you're doing, anything, especially if you're putting it in your mouth or rubbing on your skin. But massage, all of these things, we want the healthcare team to be really fully aware of what you're doing, because there's lots of things about you that might mean that might not be advisable, or there might be things that the practitioner needs to take care of, or the treatment team need to take into account when they're planning your treatment. So also keep in mind that if it's things like herbs and plant-based therapies, look, a lot of oncologists, they've got, 15-minute appointment slots and a full waiting room, and they might not actually know all of the individual plants and herbs that people talk about. I know that on our Facebook private discussion group, people talk a lot about various specific substances, and I don't know what they all do either. So a really important resource for us all is our pharmacists. And I guess the advantage of our pharmacists is they can look at all of the medication that we're on, and they can look up the specific interactions of what you're proposing to take from your complementary therapy suite, and they can give you some advice around whether there's interaction. So a good example that we looked at ages ago was someone actually asked me about vitamin C infusions. And we know that vitamin C can really play havoc with chemotherapy because of its antioxidant action. So there's absolutely complementary therapies that are contraindicated, that we don't want you to have because of safety concerns or because it might make your conventional treatment work less well. So the pharmacist is definitely a really important resource in that team who you can talk with. And at the end, I'll give you some details about the Peter Mac a drug information service that's actually available nationally. So I'll save that till the end. But if your pharmacist is looking like deer in headlights and is a bit lost as to what to tell you as well, then there's other ways of getting that information for you. The other really important thing, aside from interactions, is that most of if you're talking about substances that you're ingesting, or, so for tablets and herbs and teas and things like that, they often are broken down in the liver, and they're often excreted via the kidneys. So for people with cancers, and I know a lot of our NET patients have got significant tumours in their liver, and sometimes their kidney function is not that flash. So we want to make sure that we're checking those things out, so that if your liver's not clearing a drug as quickly as possible, as normal, for example, you might get toxicity, you might get side effects, toxic buildup of those drugs at a much lower dosage than if it was me with a normal liver function. So again, this is another reason why it's really important to talk with your oncologist and get a sense of, well, what's your liver function like, what's your kidney function like, would that change the dosage of any complementary medicines or herbs or vitamins that I was taking, as well as the standard treatments. So I wanted to talk a bit about some of the warning signs, and I guess I don't want to sound like a Debbie Downer, because there's such strong evidence to support so many complementary therapies. But I guess from with my nursing hat on, I want to make sure we're all safe. And sometimes I feel a bit worried when I see people recommending treatments in our groups when we haven't checked out that treatment for the person who, all of the people who might be reading. So I'm gonna, I don't want to be a Debbie Downer, but by the same token, I always want to keep you safe and want to really protect you from unnecessary side effects, and we want your treatments to be working as well as they can, all of them. So the first warning sign, if you're thinking, I'm not sure about this, as I said, check for the qualifications and the accreditation and the professional memberships of professional associations. If there's none of that, treat with caution. And maybe if it's just about relaxation, or something that's fairly that you're not ingesting, maybe that's less of a concern. Although even so, there can be some issues with those mind therapies and even things like counselling and stuff. So we want to make sure that people are really they're well qualified and they're in the right association. Another warning sign is that if a practitioner tells you that if you also use the conventional therapy, then the complementary therapy won't work. And that's really, I guess, going into the realm of alternative therapies rather than complementary therapies. And we do get quite alarmed when people start talking about alternative therapies that mean that they don't have their normal cancer treatment. We don't have evidence to support the use of those therapies. We don't have evidence that they cure cancers. And speaking from my own experience as a nurse, there's been several these situations, they really stick in your mind, because as a nurse we see people sometimes when they come back to the treatment centre weeks or months later and their cancer has gotten worse while they've been on something that's been sort of touted as alternative, and they've then been in a situation where we've been very limited in what we've been able to do to help them with the conventional therapy because it's too late. It's really distressing professionally when that happens, and it's happened to me a few times where I've had patients who have so regretted a decision that they made in good faith with someone who was very persuasive, and it seemed all to be great, but I would just advise caution. Please be careful. If someone's telling you, your chemotherapy or your PRRT or your radiotherapy is going to do you harm and this one won't hurt you and will cure your cancer, you've got to take that with a big grain of salt, and please be careful. If the practitioner is asking you to do something and to not tell your doctor, red light, warning. Or if they claim that they can cure your cancer, we know, as I said, I don't need to go on about that, but if they're claiming cure cancer and you won't need your conventional therapy, chances are they won't, and chances are they want to take you for a ride, and people with cancer are actually very vulnerable. We know you want to do everything you can to give yourselves the best chance, and so unfortunately very occasionally there are people who prey on vulnerable people, and they're just trying to make a quick buck, but it can have catastrophic consequences. When they claim that their therapy will do something, but when they can't actually back that up with journal articles or evidence to support that. A website isn't good enough. Anyone can publish a website. It's got to be in a peer-reviewed published journal, and they should be really open to you when we don't know if it's going to work or not. So, for example, there's plenty of complementary therapies that we don't know if they're going to work, but they probably won't hurt you. Most good quality complementary therapy practitioners will be very open in saying that and saying, well, I don't know if this will help, but it might. It's worth a try. It helps in some people. So the other warning bell is if it's exorbitant. If they're charging you hundreds or thousands and thousands of dollars on treatments, I have a high level of suspicion about scams, and so just be careful with that. We also want complementary therapy practitioners to be really open and clear about discussing potential side effects or risks with therapy, just like we do in conventional therapy. So if you go and have your chemotherapy, there'll be a consent form. If you go and have an operation, there'll be a consent form, and you'll be read the riot act about the potential risks as well as the potential benefits. So we want complementary therapy practitioners to be covering those things off as well. And I guess the last thing I would say is if someone's saying to you need to travel to Mexico, the rules around what treatments can be advertised to people with cancer in other countries are different to Australia. So in Australia, it's fantastic that we've got a really rigorous process and a Therapeutic Goods Alliance that actually monitors treatments for cancers, and not only about conventional therapies, but all of the complementary therapies as well. And so if we find that someone's shonky, we'll report them to the TGA, and they can actually be called to account for those for the therapy that they've given to people. Other countries don't have those checks and balances, and so we know that the false advertising and scams can abound. So if you're being told, you have to travel to another country to have this treatment because it's not available in Australia, because Australia are backward or whatever, then be very suspicious, because Australia are actually world leaders in NET treatment. So if the treatment for you is not available in Australia, I would just question how much evidence they've got to support it. So enough Debbie Downer. The other thing I just wanted to talk to you is that about clinical trials in complementary and alternative therapy, complementary therapies. That rolls off the tongue like a habit, doesn't it? Adding the alternative, but we really wanted to talk about complementary therapies this afternoon. So there are clinical trials in complementary therapies, and I guess the same sorts of processes around those trials should be in place as similar to what we do in conventional therapy. So if someone's talking to you about a clinical trial in a complementary therapy, it's definitely worth looking at. But make sure that, for example, the trial has been reviewed by an ethics committee. Ideally look for a trial that's being held in partnership with a university or a hospital, so that you know that there's some, good scientific rigor being applied there. So there's some other guidance. There's guidance about all of these things that I've just really briefly touched on in the booklet. So I'm going to give that another plug. It's called Understanding Complementary Therapies, and I will put a link to this in the notes. But also know that by calling Cancer Council on 13 11 20, they'll send you a free hard copy. It's so comprehensive. It's 85 pages, which is far more than I can cover off in a single, little lunchtime video. So I just couldn't recommend that highly enough. So there's some other really fantastic resources for you to find more about your situation, what you're thinking about doing or taking, and how that might interact with your other therapies. So if you're thinking about things that you put in your mouth, like herbs, like vitamins, plant-based therapies, there's a fantastic website. We've talked about it before. It's the Memorial Sloan Kettering Cancer Center. It's based in America, and they've got a website which is so comprehensive, and it's got a search function, so you can search for vitamin C, or you can search for goji berries, or you can search for beetroot juice or whatever, and it'll bring you up a page with a listing of the evidence, what we know that it does. It'll list potential interactions with cancer drugs, which is really important. It'll list known side effects and things to watch out for. So it's a fantastic resource. I'll make sure that's in the notes. The other thing that I said that I would mention is the Peter Mac Medicines Information line. Now this is there's a phone number, but there's also an email address. And they are available nationally for anyone in Australia who's having cancer treatment, who's interested in knowing more about a complementary therapy and how that might interact with their treatment. It's an incredibly generous service by a single hospital, and so don't all ring them at once or they'll curse me and shut it all down. But having said that, I've just had nothing but good experience from these guys. I contact them frequently, and my experience of them is that they've been incredibly fast with their email replies. So usually much faster than I am, I have to say. Like, if you email me, you'll get a reply hopefully within the next couple of days, whereas the information service, the medicines information service, I've had, within 10 or 20 minutes or half an hour, I've had a really comprehensive response back. So they are fantastic, and I couldn't recommend them highly enough. I'll put the contact details in the notes. There's actually a couple of other things, online resources. So I did mention the Chris O'Brien Lifehouse earlier. Now that's not known as a NET treatment centre. They certainly don't have a NET specific multidisciplinary team. So a lot of you won't be going to that hospital. It's based in Sydney. But it's just worth knowing about. My understanding from my conversation with Judith Lacey, at least last year, were that they would consider referrals from other centres for their integrative therapies service. So now don't quote me on that, but it's worthwhile having a look at their website and giving them a ring if you're particularly interested. But the other thing I really wanted to let you know, because not everybody's in Sydney, that during COVID has been such a difficult thing for all of us, but one of the side benefits is that a lot of people, Neuroendocrine Tumor Cancer Australia included in this, has really ramped up what they're doing online, and so the Chris O'Brien Lifehouse, to their credit, sort of created a YouTube channel which they've populated with some really fantastic videos, and often the videos are actually lots of them are really quite short, so 3 or 4, 5 minutes, so much less than my half an hour or an hour diatribes from me. But these are short, they're to the point, and there's demonstration of things like some of the yoga, some of the relaxation. There's some interviews and focuses on specific topics. So I will make sure that YouTube channel is in the notes as well. I'd really recommend you have a really good look at that. The other thing that I just came across, Judith Lacey was a guest speaker in an episode, which is how I came across this, and I haven't listened to any of the episodes, so it may be, I would be interested to hear your thoughts and feedback about this podcast. But it's called the Integrative Oncology Talk podcast. It looks like it's fairly new. There's only 18 episodes that have come through so far. But if you're interested in this topic, it looks like it's interviewing some really interesting experts, and certainly Judith Lacey is one of those. So I will put the link to the podcast in the notes as well. And if you want to have a listen, if you get through all 18 episodes, then kudos to you. But let me know what you think. The groups are fantastic for, being a space where you can give your recommendations about where you get your information from, what you're finding helpful, shouting out when you're finding something a challenge and having suggestions from other people. So, if you see a resource, or you're reading something that you think, or you're listening to something and think, oh, wow, this is really helpful for me, then don't forget to post it in the Facebook private discussion groups, because if it's helpful to you, chances are it'll be helpful to someone else. And I guess the proviso with that is that if someone on the Facebook groups are saying that, they're using this herb or this technique or this thing, always take it with a grain of salt. Always check with your doctor. I'm also a resource for you, so you're welcome to get in touch with me, and I can do a bit of legwork and research for you if it's all just hard to navigate websites. And I'm really happy to help out with things like that too. So I think I'm going to wrap it up there. We've talked about heaps of things. I've been going on for ages, and I know I need to have a little bit of a rest or a drink, because we have our online Zoom group meeting this afternoon for those of you who were planning to come along from our Facebook private discussion group. So that starts at 2:30 p.m. Melbourne time. That's 2 o'clock in Adelaide, and 3 hours. So anyway, I'm not going to do the time zone calculation because that's just going to end in tears. But Facebook should be displaying the starting time of that group at the correct time for your time zone. So Facebook's far more smart than I am when it comes to making time zone conversions. So yay, Facebook. So look, I'll look forward to seeing you if you're going to come to that group this afternoon. And look, I hope you have a good week. Next week is a mystery feast in terms of what we talk about in our Facebook Friday, so let me know your ideas. I've got certainly some things in the pipeline. I'm really hoping we'll get someone in to talk about COVID and vaccines in the very imminent future. But yeah, keep the ideas coming, because we want to make these videos as relevant and as helpful to you as possible. So thank you for joining me, and we'll finish up and see you soon.